In the field of Parkinson's disease and related synucleinopathies, we have an issue which is related to when we are able to diagnose these diseases. Usually it's a bit late. We would like to be able to diagnose them earlier because we think that if we are able to diagnose the diseases at an early stage, the chances for us to be successful with a possible therapeutic intervention will be higher. So this requires us to find ways for detecting the disease before the clinical diagnosis. And the way to do that involves the use of biomarkers. And here when we talk about biomarkers, we're talking about a wide range of technologies that can be used. On one level, we can use the traditional genetic tests that tell us a bit about the genetic makeup of the patients. On another hand, we can use neuroimaging, which is of course very powerful for detecting structural alterations in the brain, functional alterations, and to measure also neurodegeneration. So there are some imaging techniques like DAT-scan or DAT-SPECT that measure the loss of dopaminergic neurons in the brain. And this has been very useful in the field for aiding movement disorder specialists assess whether there is already some deficit in the function of these dopaminergic neurons, which are very important in the context of Parkinson's. The problem is that this technology doesn't really have 100% specificity. So it's useful, but alone it doesn't always get it right, meaning that sometimes you see people that do not present signs of degeneration of these neurons, but they already have clinical symptoms. So there is a disconnect that we don't fully understand. And now more recently there's been great progress in the field of biochemical markers in the field of Parkinson's. Of course, in the field of Alzheimer's, this has been going on already for a long time. In the field of Parkinson's, the advance has been more recent because people know that α-synuclein is a key player and it's the protein that accumulates in the brains of the patients. But we haven't been able to measure it in a way that we could trust that this was telling us there was something wrong happening in the brain. And now with an assay called the seed amplification assay, we're able to detect something that we think reflects a pathological alteration in the protein, which is its ability to seed the aggregation of non-aggregated proteins. So this is a simple assay that can be done using a biofluid, primarily CSF. This is where the technique is working the best so far. And so if you collect CSF and you use some of this CSF from a patient or from a control individual, you can measure the seeding activity of the protein and you can distinguish control individuals from patients. So this is a big breakthrough because now we have something that we think reflects this pathological alteration. The technique is not perfect. It's binary. It tells us whether there is this activity or not. So it's still not what we would like to be, but it's already a big advancement. And this is one important tool that clinicians will have at their disposal if they decide that they want to test this type of biomarker. But there's already been a lot of advancements in this field, and now people can do this assay in blood samples, in skin samples, hopefully in the future in other types of biofluids if we can make it work. And so there's a lot of excitement in terms of biomarkers for Parkinson's disease.